Welcome to the mini video series entitled Secrets of Modern Breast Cancer Surgery by Just Medicine. These videos will take us through medical evidence that is not universally discussed with patients. 3 chapters will focus on the data which guides modern surgical treatment of breast cancer, while a bonus video will discuss how communication is essential when helping patients come to the right decision about their therapy. Empower yourself with knowledge about the type of breast cancer surgery that helps a survivor live longer and live more. As this is an educational video, there will be references provided along the way for you to verify the facts presented. Please note that this information is not intended as a substitute for a surgical consultation, and patients are encouraged to see their doctor for appropriate treatment planning. If you have not viewed our video series on breast cancer survival, we encourage you to go through those videos first, because they will take you on a journey through the history of breast cancer surgical treatment, which provides a foundation and appreciation for the evolution of breast cancer surgical treatment, as well as other issues that will be discussed in this Secrets series. Be that as it may, we can begin immediately here in Chapter 1 and review the relevant data as we proceed. Let us begin. Although mastectomy was the mainstay of treatment for breast cancer for 70 years from 1898, there were visionary surgeons who worked to change the status quo. Dr. Umberto Veronesi from Italy was the lead investigator of what is known today as the Milan I trial, which began in 1973. After 20 years of follow-up, it was found that women who underwent breast conservation treatment had equivalent survival to those who had mastectomy. Similar findings were noted by Dr. Fisher, who led the NSABP B06 study in the United States. In 2007, analyzing registry-based data from Western Australia, Dr. Martin found that women who underwent breast conservation treatment had better survival than those who had mastectomy. This set the stage for a change in surgical treatment philosophy. The establishment of cancer registries, combined with the growth of information technology, made real-world evaluation of treatment results for large number of patients possible. This is an excerpt from one of the earlier registry-based analysis comparing survival outcomes of women who had undergone breast conservation treatment compared with those who had mastectomy. It was observed by the researchers led by Dr. Agarwal that women with early-stage breast cancer who underwent breast conservation treatment, or BCT, had a higher breast cancer-specific survival rate compared with those who underwent mastectomy with or without radiation. Please feel free to pause the video here to read the details, especially what has been highlighted, to grasp the importance of these findings. The findings reported by Dr. Agarwal are tabulated here to highlight a few details noted in the analysis. 70% of patients underwent breast conservation treatment, or BCT, with 30% receiving mastectomy. We will notice that with longer follow-up, there was a concomitant increase in the difference in breast cancer-specific survival rate in favor of BCT. In other words, a higher percentage of women who underwent BCT lived 10 years or longer than those who had mastectomy. Since all these women had early breast cancer, defined as tumors 4 centimeters in size or smaller, with involvement of 3 or fewer lymph nodes, Dr. Agarwal's team were comparing apples with apples in terms of disease severity. The difference in survival was purely due to the different type of surgical treatment the patients received. To further clarify that it was the type of surgery that was the reason for the difference in survival, Dr. Agarwal's team did additional stratifications, or subdivisions of the patient's conditions. These figures are survival curves, where the y-axis represents the proportion of women still alive, and the x-axis represent the time that has elapsed in months from the point of surgical treatment. A gradual slope downwards is expected. However, the gentler the gradient of the downward incline indicates better survival for that group of patients. If we were to follow the colors of the curves and the corresponding legends, we would see that in each patient subgroup, BCT results in higher survival outcomes. Dr. Agarwal's study was one of the earlier studies with large patient numbers to show survival benefit. Subsequent to that, there were many other studies reporting similar findings. A few of them are listed here. This table is presented just to emphasize the immense amount of data we have in support of breast conservation treatment for early breast cancer. So much so that in 2016, these experts from Edinburgh made an emphatic statement that patients who are suitable for breast conservation treatment should be advised that BCT is the best treatment option. They went further to say that it may no longer be appropriate for patients who are suitable candidates for breast conservation treatment to be offered the choice of mastectomy or BCT. Much more evidence has accumulated in the years that followed Dr. John's and Professor Dixon's very strong statement supporting BCT for early-stage breast cancer. In fact, the data is so voluminous that it may be impractical to list it all down. In an attempt to summarize the burden of information, this group of doctors from Bristol performed a meta-analysis, which is a statistical review from several studies that fulfill certain stringent criteria. Analysis of the outcomes of more than 900,000 patients demonstrated improved survival for women undergoing breast conservation treatment, and they recommended that this be shared with patients to support informed decision-making. In spite of the vast and robust evidence demonstrating improved survival with breast conservation treatment when compared to mastectomy, this information is not always made available to patients. We hope that in this video, we have made it clear that there is more than adequate evidence supporting improved survival outcomes with BCT when compared to mastectomy. Just Medicine Breast Cancer Surgery therefore recommends BCT as the primary mode of surgical treatment for early-stage breast cancer. Mastectomy may still be an option, but only if the clinical circumstances indicates its necessity. If a woman chooses mastectomy, she should be aware of potentially subjecting herself to poorer survival and other adverse outcomes. We will discuss some of these in the next two videos.